Hi, my name is Calvin Pugh, and I'm the Senior Advisor on Community Engagement for the International Association of Providers of AIDS Care. Welcome to this series of mini web modules on COVID, HIV, and me. This mini webinar focuses on the U.S. government's Test to Treat initiative. Upon successful completion of this module, learners will be able to define the U.S. government's Test to Treat initiative, identify the importance of accessing oral antivirals for treatment of COVID-19 infection, and utilize the Test to Treat locator. On March 8, 2021, the United States government launched a new initiative to make it easier for eligible Americans who test positive for COVID-19 to access oral antiviral therapeutics. As part of the National COVID-19 Preparedness Plan to help America move forward safely, the government has launched a nationwide Test to Treat initiative so Americans can rapidly access needed COVID-19 treatments. In this module, we'll look at the U.S. government's Test to Treat initiative and how to utilize the Test to Treat locator to access oral antivirals to treat COVID-19 infection outside of a clinical setting. The United States government launched a nationwide Test to Treat initiative in March of 2021 to give individuals an important way to access free life-saving treatment for COVID-19. Through this program, people are able to get tested and, if they test positive and treatments are appropriate for them, receive a prescription from a healthcare provider, either on-site or through telehealth. These one-stop Test to Treat sites are available at thousands of locations nationwide. In May, the program was expanded to include federally supported Test to Treat sites. People can continue to be tested and treated by their own healthcare providers, healthcare clinics in their community, and telehealth providers who can appropriately prescribe oral antivirals to locations where medicines are distributed. If you have COVID-19 symptoms and test positive, don't wait to get treated. You must take COVID-19 oral medications within 5 days of your first COVID-19 symptoms. The importance of the Test to Treat initiative is in the expanding access to more people in more communities across the country, especially in areas where access to healthcare or access to oral antivirals may be limited. The Department of Health and Human Services Secretary Xavier Becerra stated that tackling barriers to testing and treatment remains a priority for the government, including making sure people have access to these tools for free wherever they are, and even if they don't have health insurance. This important Test to Treat initiative will help more at-risk people get the care they need if they get sick. Building upon existing distribution of oral antivirals to thousands of locations across all states and territories, the Test to Treat initiative is part of a broader strategy to quickly connect eligible individuals who are at high risk from getting sick to appropriate treatments. The Department of Veterans Affairs is also connecting our nation's veterans who test positive at VA medical centers directly to treatment. The Test to Treat program can provide faster, easier access to life-saving COVID-19 treatments. If you test positive, you can see a healthcare provider, and if eligible, get a prescription for an oral COVID-19 treatment and have that prescription filled, all in one location. COVID-19 treatments must be started early in order to work. With the new Test to Treat initiative, eligible patients can get tested and start treatment in one visit at a participating site. The process looks a little bit like this. Step 1, to get tested for COVID-19 at a Test to Treat site, or bring in your test result from an at-home test, a pharmacy, or your healthcare provider with you to your visit. Or you can use a web-based Test to Treat locator to find a participating site near you. The second step is to get a prescription from an on-site healthcare provider if you're at high risk of getting very sick. If you test positive for COVID-19, ask the on-site healthcare provider during your appointment if you are eligible for a prescription for a COVID-19 oral antiviral treatment. Bring any medications or a list of the medications you are currently taking with you to your appointment. And the last step is to get treated. Ask the on-site or affiliated pharmacist to fill the prescription. Once your prescription has been filled, you can take your oral antiviral pills with you to begin your treatment. Now, participating locations provide access to people to get tested, and if they test positive and are eligible for that treatment, receive that prescription on-site, have their prescription filled all in one convenient location. The online locator tool was launched to help people find participating locations in their area, and the Test to Treat locator is available to help find participating sites. A call center is also available at 1-800-232-0233. Get help in English, Spanish, and even in more than 150 languages, 8 a.m. to midnight Eastern Standard Time, 7 days a week. The Disability and Access Line is also available specifically to help individuals with disabilities access services. And to get help, call 1-888-677-1199 Monday through Friday, 9 to 8 Eastern Time. Sites are chosen by the following criteria. Sites must be able to provide comprehensive end-to-end test-to-treat services to support a seamless patient experience. They must have COVID-19 testing on site or an evaluation of at-home testing. Linkage to clinical evaluation by a licensed healthcare provider after a positive result to provide prescription when appropriate. And they must be co-located or have an affiliated pharmacy available to readily dispense medication to patients. They also must provide services to all individuals regardless of insurance status and accept new patients for priority same-day or next-day COVID-19 services. Now, the Test Treat Locator states that COVID-19 medications are now available through your doctor, local pharmacies, and health clinics. If you have COVID-19 symptoms and test positive, that you shouldn't wait to get treated because you must take oral COVID-19 medication within 5 days of your first COVID-19 symptoms. You can use the tool to find a location that's right for you, and users enter their address or use their current location to select the distance and should be able to locate a test-to-treat site nearest to them. The tool also provides individuals with the addresses to the sites and how to book a test-to-treat appointment. And the locations displayed have received an order of Paxlovid or Lagavario in the last 2 months and or have reported availability of oral antiviral medications within the last 2 weeks. The sites that have not reported in the last 2 weeks display a notification with the site details. Inventory has not been reported in the last 2 weeks, and please contact the provider to make sure the product is available. On January 5th, 2023, the National Institutes of Health, in collaboration with the Administration for Strategic Preparedness and Response at the U.S. Department of Health and Human Services, launched the Home to Test to Treat program, an entirely virtual community health intervention that will provide free COVID-19 health services, at-home rapid tests, telehealth sessions, and at-home treatments in selected communities. The program supplements the Test to Treat program launched in September of 2022 to make oral antiviral treatment available to eligible individuals, which will prevent severe illness, hospitalization, or death. The key to expanding access to the Test to Treat has been the collaboration between testing sites, pharmacies, and health centers. And in conclusion, the Test to Treat initiative expands access to testing and life-saving oral antivirals to communities across the country. Utilizing the Test to Treat locator makes it simple to find a site near most communities, and it's very important to remember that oral antivirals must be taken within 5 days of COVID-19 symptoms, and that oral antivirals can prevent severe outcomes and can save lives. For more resources, please use the links here.